Hi, my name is Sophia Grimm. I work for Multnomah County Emergency Management. Prior to that position, I worked for the Centers for Disease Control and Prevention for 5 years, doing public health preparedness and injury prevention. So I'm here to talk about the pharmaceutical resource request guide that's being proposed by the Public Health Work Group. It's for about $166,000, primarily to hire a contractor and a senior data scientist. We've shopped this around a lot. It's got the approval of all 5 county public health departments within the Portland-Uwasi region, the support of our tri-county health officer, the hospital preparedness organization, the medical countermeasures coordinator, and we also reached out to the Oregon Health Authority, Washington Department of Health, and the Assistant Secretary for Preparedness and Response, Medical Countermeasures Coordinator for Region 10. And they were awesome. They reached out to their partners across the nation. They were like, has anyone done this before? And with the exception of Coos County, Oregon, back in like 2013, no one's done this. And they said, it's huge, right? Like, we need to know what pharmaceuticals to request after a catastrophic event. And they're really interested in this project and how we want to roll it out. We also spoke to the Oregon Pharmacy Board, and they said that if this project is funded, that they would like to participate. So a little bit about the project. The purpose is to prevent injuries and death by pre-identifying what retail prescription pharmaceuticals people are on and the quantities needed after a catastrophic incident to expedite resource requests for life-critical and essential psychotropic medication when normal distribution has been disrupted. So there's a couple of key things in here. The first is that we're only looking at retail prescription pharmaceuticals. That's what's dispensed out of your pharmacies. And then the second piece is the type of medication that we're looking at. We're really only looking at life-critical medication, so something that if you discontinue is going to cause injury or death. So think your heart medication, your insulin. The second type of medication that we're looking at is essential psychotropic medication. So what prevents the onset of mental health symptoms like anxiety, depression, schizophrenia. So the scope of this is really a catastrophic incident. It's not something you're going to be pulling off the shelf day to day. And the other big piece is we are not stockpiling medication. And I repeat, we are not stockpiling any medication. The key deliverables in this is a list of life-critical and essential psychotropic medication that will be determined by prescribing medical professionals in both behavioral health and in healthcare. Each county will get specific pre-scripted resource requests by pharmaceutical type, dose, route, and quantity needed to support individuals for 1 month after a catastrophic incident. And we're also building in multiple formulas to minimize the amount of updates this list has to go through. They're outlined in the application, but it's looking at your age demographic shifting, population growth, as well as kind of like the transitory portion of it, like who's in your county day to day versus in the evening, kind of season to season. So we're going to build some of that in. We're also going to work with several ethics committees, community ethics committees, to get their input on what does equitable pharmaceutical distribution and decision-making strategies look like. Ultimately, each county is responsible for the distribution aspect of this. It's part of their ESFA plan. But we all agree that we want a firm foundation on which to make those operational decisions, which is why we're going to be approaching these various ethics committees that are already pre-established. And then ultimately, this regional resource request guide, right? So it outlines how we did it, how we came up with the formulas, the results from the ethics committee, and a variety of other things. And that's really important because we want to make sure that we can do this expeditiously in the future. And we also want to provide a template for other counties in Oregon and Washington to duplicate this plan, as well as be an example across the nation. So it's just that was one-stop shop for everything. Benefits overall, it minimizes illness, injury, death. It minimizes the burden on the health and medical system. We want them to be able to prioritize the acute injuries and illnesses that arise after a catastrophic event and take care of the people that are healthy and help them maintain that health by getting them the pharmaceuticals that they need. And then ultimately, the resource requests align with the state and federal partners' needs to make sure that they can actually build the resource request.
I'll start off with a couple of
Sure.
questions. So just to clarify, you said retail only, that means not hospital pharmacies? Okay. And then you're also looking at what's currently being used, right? Like kind of on average, but also it increased, I assume, because of the incident. More life-saving medications are needed, right? So what is, it sounds kind of like a DIRA in a sense.
Yeah, so we're not looking at what is dispensed in hospitals and clinics, and that's partly because of a data quality thing. The data set that we're looking at, the way it's billed in a hospital is a patient procedure code and doesn't necessarily indicate what medication is always dispensed, is my understanding from the data scientist at Oregon Health Authority. But also the hospitals know what they need and what they use on a regular basis, and they have the hospital preparedness organization to help shepherd some of those research requests. Do you have
Can we
something to
just
say?
stop and clarify very
Sure.
quickly? There's medication dispensed inpatient.
Correct.
What about all their outpatient clinics? Are you looking at what is going to those health, like through Providence, through OHSU Health, all of those types of things?
If it's being dispensed through the pharmacy within those hospitals, then it will be in that data
Okay.
set.
Because when you
Yes.
say hospitals, you're kind of mixing verbiage that can confuse.
Sure. If
That
it's,
is exactly what I'm trying to
Yeah.
figure out.
Right.
You're addressing a gap that is not being addressed by the HPO,
Correct.
right? Okay. And
These are just outpatient.
yeah.
yes.
What else is, so you're taking a very discrete piece of that, and then also maybe the equitable distribution piece. It sounds like the retail agencies, they're on board through these trade associations you reached out to?
So we reached out to the Oregon Board of Pharmacy, which has students practicing pharmacists. They're the ones that wrote a lot of the pharmaceutical distribution laws. Like that's the word that the Oregon Health Authority works with specifically.
And so these are private companies?
Yes.
Do you see this as part of a larger body of work maybe to address the private sector? Like this is a chunk, but.
I think it starts to build that relationship.
Yeah. Thank you.
Just one more
Yeah.
clarification. I'm just taking this as an example.
Yeah.
Peritoneal dialysis. Are you
Mhm.
looking at that? Those are certain drugs, medications. Is that another area for those people that are at home doing that? And some of that, you know,
Yeah, so I'm not a prescribing medical professional, right? So, and that's why we're gonna bring together a
Okay.
board of prescribing medical professionals, and that is a great question to bring to them.
yeah, I just want to know that we're not just looking at pills and insulin, but there's a lot of other home treatments that people have to get through.
Yep.
And that's being,
Yeah.
okay.
I guess, yeah, defining what are the supplies?
What is that bigger scope? Yeah.
Yeah.
They're prescribed, right?
Yeah, if they're prescribed, then
Some
it
are,
should be in
some
the
aren't,
data.
but they still need them.
So this is sort of a question about the end product of this project.
Sure.
So we have a finished product of a 5-county regional resource request handbook. So how is that going to be integrated with that project? And maybe this sounds like something Courtney Y might be interested in. So just a question on
So,
Kind of one of
So
the
they-
next steps.
what the next step is
Or
after.
how does it
How do
relate
you-
to the existing countywide resource management request handbook and the body of work that our legislation is already kind of assigned to? Would this maybe start to, but that's kind of
Yeah.
what I was asking.
Gotcha.
Like, where does this go?
Where does this go? How does this work? Yeah, so there would be 1 to 2 workshops to kind of flush out, like making sure it fits into that kind of resource request form, making sure that it has the adequate details that Oregon Health Authority, Washington Department of Health need, and the federal government needs to actually fill that resource request. And there's a lot more details that go into filling a resource request for pharmaceuticals than say just requesting like the capability of more capacity or something like that. So there's more detail that's involved. But yes, it will be workshopped with partners. We would be inviting a regional logistician and
So you're going to take as a base for this the regional resource request handbook.
I see that one as being general and you're doing something
it's
specific
pretty
with it.
specific. It's
Yeah.
the medication is going to be very detailed.
Plus,
Right.
plus package.
Right.
Yeah.
Right, but it needs to be integrated, and that, I mean, that's
Yes.
the base. I mean, as a region, we've agreed that this is the process that we're gonna use to request things. So I understand that pharmaceuticals have a lot of specific requirements they can put in their request. I'm pretty sure that the format
It should
should work
accommodate
for
that,
it.
yes.
But yeah, I mean, I think that this is kind of like a chapter or like an appendix to that, rather than like if it is totally separate. Right, because
Yeah.
long term, they're gonna be requested from the same facilities, from the same staff, from the same, right?
Yeah, so each county will get their list of medications that they will need, and they can move that through their state, whether it's from Clark County, from Multnomah County, up to Oregon Health Authority, Oregon Emergency Management to Oregon Health Authority, and then up to ASPR. But yes,
Does that satisfy what you're
Does
looking
that-
for, Courtney?
help,
So you expect it to be like a pre-scripted
yes,
request?
for each county.
Okay.
Yeah, and I guess I would say this is a good step in kind of implementing the framework that we set up with the Resource Management Committee with that project, and now you're kind of drawing, one discipline out of it and doing the pre-scripted packages, and hopefully we can start to do that with some other disciplines as well. So I think that will fit right in. All right.
So it does stop at the guidebook, but maybe eventually an exercise.